Okay. And then Janine, could you help me out with a thumbs up? Can you see my slides okay?
Yes, I can. Sorry,
Okay.
I couldn't find my thumb.
Very good. Thank you so much. Well, welcome all for joining. You are in the right place for our webinar, Welcome to the World of Community Health Centers. For folks I haven't met before, my name is Rochelle Andre. I'm the Government Relations Specialist with the Wisconsin Primary Healthcare Association. This webinar is being recorded. I will also share the slide deck as well as the recording and some additional resources in an email for you just following this webinar. We'll keep it relatively informal, so if there are burning questions that you have while I provide an overview, please feel free to either raise your hand or drop those in the chat, and I can pause and take a look. Otherwise, we will have some time at the end for discussions and conversation as well. Any logistics or other issues folks need to raise before I dive in today? All right. Okay. I will note this webinar is primarily designed for legislative staff, so there may be some resources here that are more or less relevant for you, but I will plan to provide an introduction to community health centers, discuss how community health centers as well as the Wisconsin Primary Healthcare Association can support your work with constituents, let you know about a few public policy issues that are top of mind for community health centers in Wisconsin, and then address additional resources. That is our plan for the next half hour or so. So just to begin, I will also just thank you for your interest in community health centers. Certainly want to appreciate the unique role they have in the state, and very much appreciate you joining us today. So a little bit of background. What are community health centers? They are also known as federally qualified health centers. You may hear that term, or an FQHC. In healthcare, we love to use lots of jargon, acronyms, and lots of complex language. So I'll try to just refer to them as community health centers here today. And they are clinics that provide primary care and preventative services. Now, we define primary and preventative care pretty broadly in the community health center world. So that is not just strictly medical preventative care, but also behavioral health and substance use disorder care, and dental, which is a very significant area of work for community health centers in Wisconsin. Another area that community health centers are very involved with is connecting their patients to social services. So making referrals for housing or food access. Further, something that I think is very exciting about community health centers is they often have staff on site in their clinics that can help a patient get enrolled or connected with the benefits that they are eligible for. For example, we have community health centers in the state that are actually enrolled, credentialed ACA insurance navigators, so they can actually help someone get enrolled in a commercial insurance plan through the marketplace, as an example. Every single community health center is a private or public nonprofit organization. The role of health centers is to serve high-need communities. That is often an area that might be a healthcare desert or has limited access to care. They must also be governed by a patient majority board of directors. So the actual governing body for the nonprofit is made up primarily of patients that are served by that community health center, which means it is patients who are having the ultimate say in the direction of that clinic, whether it is expansion or a new service or a change in the way they are doing their work. I think that's something that's very special for community health centers. And then what also makes them quite unique is that community health centers must provide care regardless of a patient's insurance status or ability to pay. Now, the way they do that is they accept commercial insurance. So if you have a kind of a run-of-the-mill commercial insurance, you can go to a community health center and get your care. We'll bill your insurance. If you are enrolled in the state Medicaid program, Badger Care, you can get care at a community health center. We'll take your Badger Care insurance and leverage that for your services. But if you are uninsured or underinsured, a community health center will also provide care for you, and they will do that according to setting a sliding fee scale. So that scale is something that is publicly available, published, and accessible to all patients to know in advance how much will they be billed for a visit. So for example, for a preventative children, a wellness visit for someone who's uninsured, they may be able to look according to your income. This might be a $10 visit or a $20 visit, and that is adjusted according to that income level. So that is something that makes health centers very unique. They are not allowed to discriminate based on the insurance status of a patient seeking care at their clinic. Now, they might not have all of the providers they need to meet every single need in the community, or might have some other challenges to meeting those needs, but the insurance status of a patient cannot be one of those factors they use in determining someone's care. Finally, I'll note that they are part of this federal program, which includes about 1,400 community health centers nationwide. And as part of that federal program, they must meet performance requirements and publicly report all kinds of data, whether that is clinical or financial data or other components as well. And that makes my job as our government relations specialist a little bit easier, because I can look to a lot of these data sources to really help paint the picture of what community health centers are doing here in Wisconsin, which I'll be showing you in the next few slides. So a little bit of that data. Who are community health centers serving in Wisconsin? This is primarily individuals who are low income. So for example, you can see here in the orange graph, the upper bar there, almost 60% of the patients served at community health centers in Wisconsin are making 100% or below of the federal poverty line. Now, if I say federal poverty line, you're not sure what that means. The details of that is for a family of 4, that is making under $26,500 a year. So imagine 60% of the people served at community health centers for a family of 4 are making under $26,500 a year. Another 15 or so % are making up to 150% of that federal poverty line. And then a small portion, 6% only, are making over that $26,500 limit. So community health centers are primarily aiming to serve people who have limited access to care and limited means, though they do provide care to anyone regardless of their income status. On the insurance side of things, I mentioned Medicaid already, which is the Badger Cares, a state Medicaid program that provides a state health insurance option for not only children and families, but also adults. And almost 60% of the individuals served at community health centers are enrolled in the Medicaid program. That means we work on a lot of Medicaid policy issues and are always happy to be a resource on Medicaid in the state. About 15% of community health center patients are uninsured, and about the same percent have private insurance. Some other insurance, Veterans Affairs insurance or others are accepted at community health centers too. When we are looking at the population served by community health centers, those demographics are in the right-hand corner here as well in the blue graphs. So this just gives you a little bit, paints the picture of who community health centers are serving in the state. And then in terms of demographics, we are primarily providing care for adults, though children make up a lot of those visits as well. Many community health centers also provide care for special populations. That's sort of a broad category, but some of them do have some special expertise, for example, in providing care for individuals experiencing homelessness or migrant seasonal agricultural workers or children in schools. So there is, for example, I think this is a pretty cool program. There is one community health center in Wisconsin that has a mobile clinic and actually goes to visit various farm workers at different farms around the state. And they have some special expertise in providing that care. Another clinic in Wisconsin actually has a medical center embedded in a homeless shelter, and they are able to access that care right on site. So some special populations served by community health centers in the state. When we're just at a high level discussing visits, health centers provided more than 1 million unique patient visits to Wisconsin residents in 2021. That is the most recent year of available data. And then this chart on the right here, I really like because it shows the virtual visits and the in-person visits that were provided to community health center patients. Certainly during COVID, there was a significant expansion of visits provided virtually. And it may not be too surprising for you to see that a lot of behavioral health visits now are provided via a virtual means, whether that is an audio visual encounter like we're having here today. That could also be a phone encounter or someone accessing counseling services that maybe wouldn't need a visual component. I will note that Virtual visits are also important for medical care. A lot of triaging happens over virtual visits, for example. So imagining a case where someone is experiencing a rash and they want to know, is this emergency? Do I need to go into a hospital, or can I make a visit with you next week? Or could you even take a look at it while we're here on a virtual visit and prescribe a medication for me and I could pick it up? That would be considered a medical visit encounter provided virtually. Health centers provide all of these services in that primary care model. And it is also a component of the care health centers provide is to do that in as integrated of a way as possible. So often community health centers will really try to have these services available either on site at the same location or get their teams of providers communicating about a patient. So I have commercial insurance and I go to a dentist down the street, and the primary care provider in a different health system across the other side of town. My dentist and my primary care provider have never talked to each other. They don't even know who they are. That is generally a different situation at community health centers, where they're really trying to communicate and address the needs more holistically for the patients they serve. We think that's pretty exciting. And I'll also note that these services are really in a medical home model. So this is not just a one-off where you go get a visit and never see your provider again. It is, and sometimes we call that episodic care, kind of a one-off. These visits are ongoing, preventative, established relationships with primary care providers across the spectrum. You may be wondering, where are all of these clinics in Wisconsin? This is a map from the last year. There are 17 community health centers. And then we actually just added 2 brand new ones just within the last month here in the state. Those are not included on the list, but we're basically up to 19 now. The new ones are Rock River Community Clinic, which is located between Madison and Milwaukee, as well as Muslim Community and Health Center, which is in the Milwaukee area. They serve a significant refugee population. As you can see in the map here, a lot of community health centers are located in either quite urban or very rural areas that don't have a lot of other options for care. Many health centers have multiple locations. So this map shows the main clinic location for each of those 17 nonprofits, as well as some of their bigger satellite locations. If they provide services, let's say at a school 2 days a week, or within a skilled nursing facility, those are not reflected on the map here. But in 2021, health centers provided care at more than 200 service locations in Wisconsin, brick and mortar sites. So that doesn't include any virtual visits or the mobile clinics. I'll just give a few examples of unique programs just to sort of get you a little bit more interested in the community health center model. And if you've seen one community health center, you've seen one community health center. They're each very unique and really adapting to the specific needs of that particular community. So just a few examples here. North Lakes is a community health center that provides care across almost, I think, 14 counties now in northern Wisconsin. And why I note that is kind of exciting because they provide care not only in a handful of skilled nursing facilities, but also in elementary schools and child care centers. So they make visits to those clinics and set up ongoing relationships with those patients. And those are some really wonderful partnerships. Down in the left-hand corner there, you can see a group standing in front of a mobile clinic. That's the entity I noted earlier that actually travels around to visit farm workers. They provide dental care and medical services to those farm workers, the folks that are really keeping our farm industry running here in Wisconsin, who may not have typical sources of care, or maybe if they're located in an area that does have good healthcare, perhaps those healthcare organizations are not open during the hours that a farm worker might be able to access them. So for example, I was just visiting this clinic last week. They reminded me that they made a visit at 2 in the morning to do primary care visits for a local farm community, because that was really the only time that the farm workers wanted to not be working. They were working way from 6 a.m. until after midnight. So this was a good time for folks to get care. Here in the middle, that is just a picture from one of the community health centers that has a significant new moms program. So they talked
to Dr. Goyle about it last week.
Let me just make sure folks are on mute. Thank you so much. This is from a program that provides a lot of new services for new moms and little kiddos. So they provide clothing and even have like a newborn box that they send home with parents. Now, health centers don't actually deliver babies at their clinics. Those are all done in more of a hospital setting, but they establish that primary care for them. Up in the right-hand corner is a picture from Gerald L. Ignace Indian Health Center. They are a special type of clinic that is both a federally qualified health center as well as a tribal clinic located in the Milwaukee area. And they provide a lot of culturally sensitive care to tribal populations in that community. Then in the lower right-hand corner, just another a cool example of a health center innovation. This is a community health center's community garden. So when folks visit that clinic for care, they also walk away with a food box. Those are culturally appropriate foods. I think this was new information to me, but makes a lot of sense when I learned more. Oftentimes when folks have strong cultural traditions, when you go to a food bank or a grocery store, it may be tricky to find foods that actually meet your cultural and nutrition needs. This community health center grows the foods that people that they serve want to eat. Particularly this community health center serves a significant Hmong population in the Wausau area. And they also provide a lot of culturally sensitive services for that population, as well as have many bilingual staff. So just a few exciting examples. I provided all the information that hopefully you need about community health centers today, but just so you know where I come into the picture, I work for the Wisconsin Primary Healthcare Association. We are the association for all of those 19 community health centers in Wisconsin. We envision a future where individuals and communities in our state can achieve their highest health potential. And our role is to provide training and technical assistance to those community health centers. That is everything from bringing together the medical directors or the folks working in behavioral health or dental services to learn and share best practices from each other, to driving events and engagement, helping them do their work better, or even maybe share or expand services together, help them do things that each individual community health center could not do on their own. Part of my work then is developing and advocating on behalf of bipartisan priorities at both the state and the federal level. We work in the areas of these kind of 4 buckets, which are high quality care, health insurance coverage, workforce, and community health. Let me just check and make sure I'm not missing anything in the chat so far. Don't think so. So how can we help? One thing that I'll note is as legislation crosses your desk or as you have questions that come up about health issues, WPHCA, me, or community health centers can be a resource if you need subject matter experts. So if you're looking at some legislation or a proposal coming through related to dental access or insurance, we'd be happy to provide input or connect you with the local community health center in your area to really understand what are the pros and cons, or how might that impact health centers or the patients in their community. Something else that I want to make folks aware of, if you're not already, is something significant that'll be happening in the next few months and throughout the course of the next year in Wisconsin. So that is what is affectionately called the Medicaid unwinding. So the backstory here is that for the last 2+ years, while we have been in a federal public health emergency, their states needed to basically keep patients on their Medicaid rolls. Typically, someone would have to redetermine their eligibility, show their proof of income, submit a lot of documentation annually, more or less. Everyone basically who had been enrolled in the Medicaid program has stayed on the Medicaid program for the last 2.5 years and has not had to show all those documents, provide them to the state Medicaid agency. What we just learned is in a federal bill that was passed at the end of December, basically states are going to need to begin the process of unwinding that continuous eligibility for Medicaid patients, which entails a big lift both from patients as well as providers like health centers and the state Medicaid agency here in Wisconsin. What they will be doing is basically for all these people that are on the Medicaid program right now, that's more than 1.3 million people in the state, they will need to start resubmitting paperwork, renewing their eligibility, And that will begin later this spring and will last over the course of a year. So people will start receiving letters and notifications and information that they will need to redetermine their eligibility. And then we'll have a time period to submit that documentation. But it's reasonable to assume that some people who are currently enrolled in the Medicaid program will no longer be eligible. Those people will either become uninsured or could apply for other programs they're eligible for, like a marketplace plan, or they might still be in the Medicaid program or might experience a disruption. Maybe they are eligible for Medicaid, but there's a transition period or they miss the documents and need to submit them later. So maybe they're temporarily uninsured or confused about what their coverage may be or what their benefits are. This is going to be a huge process. The state agency has been working with stakeholders like the Wisconsin Primary Healthcare Association and others for the last 2 years, trying to plan for this, trying to do it as seamlessly as possible. But it is something that we want legislative offices to know about, because health centers can both be a resource in terms of getting patients connected to care. If someone is experiencing some new coverage, or if they become uninsured and are looking for their next primary care home, your local community health center could be that home. If there are policy questions, or if you're trying to figure out what is happening with this Medicaid unwinding process, we can also be a resource on that. I do know that the state health agency is planning a lot of outreach to legislative offices on this. Janine, I love your question in the chat. Janine asks, is this going to be a surprise for Medicaid patients? It will be a surprise for many Medicaid patients. They have not had to think about doing any of this for 2 or more years. What we know the state agency is doing has been prioritizing making sure that people have accurate mailing information on record with the Medicaid agency. That is the way that people will be receiving renewal notifications. But many people may have moved, may not be expecting this, and may be confused. So the last thing we want to do is tell people that their coverage is ending when it's not, or tell them prematurely, because that might delay someone accessing care. So what the state will start to do later this spring is sort of little by little gradually start sending out those renewal notifications. It will not be a million letters in the mail on April 1st. It will be groups of people over the full year period. So what we really want to be sure to do is not preemptively notify someone, because they may not have to redetermine eligibility until 6 months from now, and we don't want to scare them. But it will be a surprise for many people. So please do consider us a resource, both in terms of policy or questions on what is happening, as well as a connection for patients. Some of the public policy issues that we are looking at for this legislative session are included here. This is information that I will be very happy to provide via email. 2 of the legislative issues are returning to us. They were on the radar last session and are back. So I will just touch on them briefly for you here. The first is related to dental therapy. So a dental therapist is sort of a mid-level provider, like a nurse practitioner or a PA on the medical side of things, but in the dental team. Dental therapists are not currently authorized to practice in Wisconsin, but they are in 13 other states, including our neighbor, Minnesota. We believe strongly that authorizing practice of dental therapists in Wisconsin would be an excellent tool in the toolkit to expanding access to dental care. Most of Wisconsin's counties are considered dental care shortage areas. We hear very frequently from community health centers that they really struggle to find all members of the dental team, but especially dental assistants and hygienists. And we've really got to make sure that people are working at the top of their scope, at the top of their license, saving the most complex procedures for dentists. Dental therapists could take on a lot of those roles, so that we are just having dentists do those really complicated things with patients. So that is a bill that we are excited to bring forward again. And I think you can expect to see that introduced within the next month. I would be very happy to answer any questions about dental therapy. We do have an issue brief about it that I will send to you. Another issue that we will work on next session, it was, and each of these are bipartisan bills that were introduced in both houses last year, and we'll be back again. The other one is Medicaid postpartum extension. So this is a little bit of a nerdy policy issue, but essentially right now there are women who qualify for the Medicaid program just due to their pregnancy. They don't meet the income eligibility restrictions otherwise. These women currently are eligible for care up to 60 days following the birth of their child. But at that 60-day mark, they are no longer eligible for the Medicaid program and lose their health insurance. What this legislation would do is extend that coverage to a full year. A time in someone's life when they are pregnant and just after their pregnancy is a very complicated medical position for a woman to be in. And we really do see a lot of data in other states, and this is also in an issue brief that I will send to you, that that extension of coverage to a full year has a lot of positive health outcomes, not only for the mom, but for the child. Having a healthy parent is critical to having a healthy newborn. So those are issues that we will continue to work on this session, and I feel optimistic that both will get done. On the budget side of things, we are pretty focused on workforce issues. So I will highlight a few of the ideas we have for the state biennial budget. One thing that we are doing is really thinking through how can we get young learners engaged in health professions and help them understand the wide range of health professions that are available to them. Along with this interest in getting more students engaged in health professions is thinking about both the diversity of who goes into health professions and where they're located in the state. So there are only so many training programs. There are only so many, medical schools, dental schools, behavioral health, counseling programs, all of that. And we are really looking to make sure that folks are represented in those training programs from lots of different backgrounds, from rural areas, from urban areas, that it's not just people whose parents are doctors who go into medical school. So we're thinking through what kind of programming could the state support that would help more people get into health professions and diversify those health professionals themselves. One of the ideas that we have been working on is in conjunction with area health education centers, also known as AHEC. AHECs operate in 7 regions and work with a lot of technical college students running things like health professions camps and mentoring programs. We would love to see some state funding for those regional nonprofits to do more of that work, but at the high school level. Let's catch students early and get them engaged in those professions and connected with people who are already in those professions now that are maybe from the same area or background of those students. That's something that we're really excited about to propose in the budget. We also want to look at the state's existing loan assistance program. The Wisconsin Office of Rural Health offers a state loan assistance program that provides up to $25,000 or $50,000 if someone commits to serving in a health profession shortage area for 3 years. Types of professionals that are eligible for that program range from nurse practitioners to dental hygienists to physicians. Right now, entry-level professionals, though, like medical assistants or dental assistants, don't have any options for loan assistance, whether it's at the state or federal level. The same goes for behavioral health providers. Folks like counselors and substance use disorder treatment professionals are not eligible for any state-based loan assistance programs. The benefit there is that if we were to include them in our state loan assistance program, we could actually receive a federal match for doing that. So that's something we would like to see happen in the next biennial budget as well. The third and fourth recommendations are really about pipeline. So looking at what are the resources that technical colleges and UW system schools need to reduce their wait lists, expand class sizes, or build new programs so that we can actually accommodate the demand there is for people going into health professions. So those are a few of the items we are thinking about in the state budget. I will just flag some resources here that I mentioned earlier. So a few things that we are working on. We have new data that will actually show each legislator where the health centers are in their district and what the demographics are for the patients served by those community health centers to show income level and their insurance status. We do have new issue briefs on both dental therapy and Medicaid postpartum coverage, as I noted. We also have a workforce issue brief that I will send to you as well. I think those are my big items for today. Certainly want to invite anyone who has not visited a community health center recently to reach out if you would like to take a tour or connect on any policy issues. So that is my big overview. I'm going to stop our recording here.